My name is Mayanja Ahmed. I'm an orthopedic surgeon by training. I come from Uganda. I'm here under the facilitation of the AO Alliance, which is an organization that deals with the improving health care in the departments of orthopedics and neurosurgery in developing countries, especially on the continent of Africa. I've been here so far for 2.5 months since I came to Kigali, Rwanda. There are a lot of similarities between our healthcare systems in Uganda and Rwanda. The demographics of our patients and the demographics of the different disease processes have a lot of similarities. So I find King Faisal actually a very perfect training environment as far as our healthcare facilities and provision is concerned, both in Uganda and Rwanda. So I find that especially the department where I work, treatment and management of patients with such disorders tend to be very costly. So there is a system here where most of the citizens are on a national insurance. So they are able to access very good healthcare services, and that helps to reduce the general healthcare burden, especially associated with the non-communicable musculoskeletal diseases, especially of the spine and the brain, as compared to the country where I come from. There is also a bit more accessibility to a little bit of higher quality facilities, services, such as the provision of implants, the timeliness by which patients receive care, and the follow-up as far as patient care is concerned. Training under a different set of specialists who have had different experiences, a wealth of experiences from within and outside, has opened up and reoriented my thinking about how to approach certain diseases. I have had challenges interacting with the patients, and as a doctor, a patient-doctor relationship is something that is very key. So that has somehow hindered my participation in healthcare service. Sometimes I've also had challenges with working, because King Faisal tends to deliver healthcare services at a worldly kind of class. So sometimes we have to work in the wee hours of the night, and I stay about 3 kilometers away from the facility. But the hospital has been able to provide me transport on different occasions to transport me back to my facility.